stroke is a very scary thing, right? All of a sudden, imagine not being able to move your arm. All of a sudden, you can't see. All of a sudden, you can't speak. And it does happen, and it can even happen to young people. So I think a general overview of what can lead to a stroke is really important to know. So one of the common risk factors is actually blood pressure. Super high blood pressure, when it's constant and unmanageable, can cause tightening of the arteries. And when those arteries tighten, there's not enough blood flow to the brain, and suddenly you can have complete necrosis or death of a particular part of the brain, and that is what a stroke is. So other risk factors are super high cholesterol combined with diabetes, combined with high blood pressure, is a triple threat. So if you have diabetes, if you have high blood pressure, and you have high cholesterol, you really need to speak to someone to manage those conditions, because that's a triple threat for stroke. And you certainly can manage those. You can reduce your glucose or blood sugar. You can reduce your cholesterol. And it doesn't always have to be with medications. It could be with diet and exercise. And another very common and devastating cause of stroke is heart arrhythmias. One called atrial fibrillation, many of you have heard of, is where the heart is not beating at a normal sinus rhythm, we call it. It beats irregularly. That often leads to blood clots, which then travel up to the brain and cause complete cessation of blood flow to a particular part of the brain. And suddenly you can't speak, suddenly you can't walk. But some of you may be concerned with, what if you have, when you're super angry or you're super emotional, are you going to have a stroke? Not really, not necessarily. It's not always the case. If your blood pressure is otherwise normal, if your cholesterol is relatively normal, then you should not really be at risk for stroke unless it's happening day to day, minute to minute. So that was a quick take on stroke. Stroke is very common, or I shouldn't say very common, but a common cause of disability around the nation, around the world. And if you're smoking, stop smoking. If you have diabetes, try to manage it as best you can, reducing your blood sugar. Those are some of the modifiable risk factors that you can work on to reduce your risk of stroke. And just as a personal story, I obviously had another birthday not too long ago, and I've been, very curious about my own cholesterol, about my own blood pressure. So I had it checked, and luckily my arteries are good, my blood pressure is good. So you definitely should get a checkup on a regular basis, and you're not going to have any symptoms until you have it. So in other words, it's not like you're going to have preliminary symptoms of having high blood pressure or having high sugar. They're not going to really cause any symptoms until you have that blood clot or that blood vessel that stops flowing, having blood flowing through it, and a stroke. So I encourage you to have regular checkups, especially if you have those risk factors.